Hello, spectacular human sexuality students. I'm happy to have you back. Today, we're going to be talking about sexual anatomy. Well, why is it important to study sexual anatomy? Well, for one thing, it's important for us to understand and be able to maintain our sexual health. It's also important for us to be able to improve sexual pleasure, as well as for us to understand reproduction. So let's get started. So there's two categories of sexual organs. There's external organs and internal organs. So we're going to start by reviewing female external organs. So the female external organs are known collectively as the vulva. What is it? Yeah, the vulva. So our female external organs are known as the vulva. And the vulva consists of the mons pubis, the clitoris, the labia majora, the outer lips, and the labia minora, the inner lips, and the vaginal opening, which we also call the introitus. So I'm going to go through each of these organs now specifically, but first I'm going to show you a diagram. So at the top of this figure, you can see the picture of the mons pubis. Then next down posteriorly is the prepuce, also called the hood that covers the clitoris. Then you'll see the clitoris. Then after the clitoris on the left will be the opening of their urethra. You'll see right in the middle, right under the clitoris. Then below the clitoris, you will see the vagina. Below the vagina, you'll see the fourchette, where the two of the inner lips come together at the fold called the fourchette. Then between the vagina and the anus is the perineum or perineum, which is also very sensitive. So you'll see here also the hairy outer lips, the labia majora, and the hairless inner lips, the labia minora. You'll see the Bartholin glands that are located underneath the inner lips, the Bartholin glands. Now we've got an eye clicker question. Which of the following terms refers to the external genitals of the female? Is it A, the clitoris, B, the uterus, C, the vagina, or D, the vulva? D, the vulva, is the correct answer. So the clitoris. The clitoris is a sensitive organ that's very important in the female sexual response. The tip of the clitoris is a knob of tissue that extends externally in front of the vaginal opening and the urethral opening. The shaft of the clitoris consists of two corpora cavernosa, and the crura are two longer spongy bodies that lie deep in the body and run from the tip to either side of the vagina. So let me show you what this looks like. So at the top of this image, you'll see the symphysis pubis. This is where the two pubic bones come together. There's the suspensory ligament of the clitoris that holds up the corpora cavernosa of the clitoris. You'll see the prepuce of the clitoris and the glands of the clitoris. Then you see the frenulum of the clitoris here. You'll see the crura of the clitoris as well. Here you'll see the inner lips. In the middle is the vaginal opening. You'll see the vestibular bulb and the greater vestibular gland and its orifices. At the back here, you'll see the vestibule of the vagina and the frenulum of the inner lips. Back here is the external anal sphincter muscle, the most important muscle in the body, as it holds in our poop, right? Very important muscle. It's the one that when you contract it, it closes off that circle and closes off the anus and keeps your poop on the inside. Over here, you'll see the cavernous muscle. This is the muscle that runs from the ischial bone. Then you'll also see the remnants of the hymen here along the sides of the opening of the vagina. Then you'll see the external urethral opening, right, where the urine comes out of the female. So that's the structure of the clitoris, as well as some other organs in the female sexual anatomy. The penis in the male is homologous, which means it comes from the same origins, tissue origins, to the blank in the female. The penis in the male is homologous to the blank in the female. Is it A, the vagina, B, the clitoris, C, the mons pubis, or D, the hymen? Well, the penis comes from the same tissue as the clitoris does. The mons pubis, mons in Latin means mountain. The mons pubis is also called the mons veneris, Veneris Latin for being Venus, right? So the goddess of love. So the mons pubis is named after the goddess of love as well. It's a rounded, fatty pad of tissue covered with pubic hair that rests at the front of the body. It lies over the pubic symphysis, where the two pubic bones come and join together. And it helps protect the body during sexual intercourse. Lies on top of the junction of the pubic bones. The labia, meaning lips, the labia majora are the outer lips. They're rounded pads of fatty tissue that lie along both sides of the vaginal opening. The labia majora are covered with pubic hair. The labia minora are the inner lips. They are two hairless folds of skin that lie between the outer lips, and they run right along the edge of the vaginal opening. I like to think of them kind of like those bumper gutters that you put up at the bowling alley, right? I think of the labia minora kind of being like those bumper gutters. They kind of direct the penis or the sex toy into the vagina. The labia minora, or their inner lips, extend forward and they come together in the front to form the clitoral hood, and they come together in the back to create the fourchette. The hymen is the thin membrane which, if it's present, partially covers the vaginal opening. And we know that the hymen varies in physical types. Sometimes the hymen covers most of the vaginal opening. Sometimes it covers a crescent shape, kind of like a moon shape. Sometimes it has a whole bunch of bigger holes and sometimes smaller holes. We also call the hymen the cherry or the maidenhead. It's really important to understand that the hymen is not a sign of virginity. Some females are born without a full hymen. Some of them injure it through riding horses or other falls or traumatic events. And so hymens are not sign of virginity. And I know we talked about that at the beginning of the class and how that was problematic for women in earlier times, when oftentimes a sign of them being a virgin was having blood on their sheets as a sign of the hymen having torn, releasing blood as being a sign of their virginity, which could be very important for their marriage vows being seen as completed and a sign of the woman giving her virginity to the husband. So we're going to talk a minute about female genital cutting, or FGC. We also call female genital cutting, female genital mutilation. It's typically performed on girls between infancy to the age of 15. According to the World Health Organization, female genital cutting is practiced in several different forms. The first type, the clitoridectomy, involves a partial or total removal of the clitoris. Occasionally, they'll just remove the prepuce, the hood that covers the clitoris. Female circumcision is the term that's sometimes used for clitoridectomy. Type 2 female genital mutilation is known as excision, where they partially or totally remove the clitoris and the inner lips, the labia minora. Type 3 female genital cutting is called infibulation, where they totally remove the clitoris. They take all of the inner lips and part of the outer lips. Then they sew the raw edges of the outer lips together to cover the urethral opening and the vaginal entrance, leaving just a small opening for the passage of urine and menstrual fluids. With infibulation, sometimes this takes place outside of doctors' quarters, outside of hospitals. There are many tribes that still practice infibulation in Africa and other areas of the world. And oftentimes it's performed by non-medical personnel, by tribal leaders or religious leaders, and sometimes with rather blunt instruments. And you can imagine that this practice can lead to infection, as it can be difficult for urine as well as menstrual fluids to get easy access back to the external environment. And so this can be a very dangerous practice when it's done without clean instruments in areas where there's not great sanitation, and can be dangerous for the females who are having this performed on them. Type 4 is all other female genital procedures for non-medical purposes, including nicking or piercing the prepuce. So which of the following is the simplest form of female genital cutting, classified as type 1 by the World Health Organization? Is it castration, clitoridectomy, infibulation, or excision? It's clitoridectomy, right? The simplest form, oftentimes called female circumcision, is clitoridectomy. So I'm going to go back for a second and talk to you about the fourchette, which I just briefly mentioned as being the kind of where the inner lips come back together at the back of the vaginal opening. The fourchette is what oftentimes gets cut in childbirth, right? If the baby's head is having a difficult time getting through, sometimes they'll cut the fourchette into the perineum, and they'll need to sew that back up to help the woman heal after childbirth. All right, so we've talked about the external female organs. Now let's talk about the female internal sexual organs. The vagina, the vestibular bulbs, the Skene's glands, or oftentimes called the female prostate, the uterus, the fallopian tubes, and the ovaries. So here are two diagrams. The top diagram you'll see is a female as if she has been cut in half, and she's looking to the left side of the screen. And you'll see the white oval. This is the pubic bone. Here is the bladder, right, with the urethra, right, and with the entrance to the urethra right here, the pee pipe on a woman. Here's the bladder. Here's the uterus, right? You'll notice that the uterus is sitting where? Yes, on top of the bladder. So when women get pregnant and they have babies, oftentimes they need to urinate frequently. And why is that? Because the baby's weight is sitting on top of the bladder, right? So you can see why women who are pregnant oftentimes need to use the restroom frequently. So here's the uterus. It lies back on top of the bladder. You'll see here is the fallopian tube. This would be the right fallopian tube and the right ovary. You'll see here is the entrance to the vaginal canal. Here's the vagina here. It's tube-like structure. At the back here, at the very entrance of the uterus, we see the cervix. Here, resting between the urethra and the vaginal canal, is where the Skene's gland is located. Back here we have the anus and entrance into the rectum. So it's important to notice from the front to the back, everyone pay close attention. At the front you would have the clitoris first, then you would have the urethral entrance, then the vaginal entrance, and then the anal entrance. Clitoris, vaginal entrance, clitoris, urethral entrance, the urethral orifice, the vaginal entrance, often called the introitus, and the anal entrance. Again, clitoris, clitoris, urethral entrance, vaginal entrance, and anus. So this is really important for all you nursing students, right? So when you're going to catheterize someone, right, to try to get urine, you want to make sure you can find the clitoris, right? Find the vaginal opening, and the urethral opening is between the two. It's between the clitoris and the vaginal opening. So when you put the important medical instrument into the urethra, you want to make sure that you put it between the clitoris and the vaginal entrance, the introitus. Okay, so that was the top picture. The bottom picture here is as if you had blown up this picture of a female lying on her back. You would see this is the entrance into the vagina, right? And here's the cervical canal, the first part of the uterus, the cervical canal. Then here we have the fundus of the uterus, which is the top of the uterus, the body of the uterus. Connecting the uterus with our ovaries is the ovarian ligament at the top and the broad ligament here at the bottom. So the broad ligament is very broad. It attaches the side of the uterus to the ovary, and the ovarian ligament attaches, it's a thinner ligament. Okay. The wall of the uterus is composed of three different parts. There's the inside called the endometrium that has lots of glands and blood vessels. There's the myometrium, which is a muscular layer of the wall of the uterus. And then there's the perimetrium, or the serosa, the outside of the uterus, Then we have here the ovaries. You can see there's lots of different follicles here. And there's one follicle that just ruptured to release an egg. Here are the fimbriae, or the finger-like projections of the fallopian tube, right? The fallopian tube is this structure right here. You have the fimbriae of the fallopian tube. You have the infundibulum, which is this first portion right here, the ampulla, the isthmus of the fallopian tubes. All right. So here we go again. The vagina, cervical canal, the three layers of the uterus. What were they? Yeah, the endometrium, the inside layer, then the myometrium, the muscular layer, and then the perimetrium, the outside layer. The broad ligament. What's this? The ovarian ligament. Here's the ovaries, right? One of them. Here's the other one. And as if we had cut the ovary in half, you'd see some follicles in there. So undeveloped eggs in these follicles. Then here's a follicle that ruptured and released a mature egg. Here's the fimbriae of the fallopian tube, the infundibulum of the fallopian tube, the ampulla, and then the isthmus of the fallopian tube. And here's the fundus of the uterus that's at the top of the uterus. So the vagina is a tube-shaped organ into which the penis is inserted during coitus, during vaginal intercourse. It's the passageway through which a baby comes out during birth, right? Sometimes we call the vagina the birth canal. At the bottom, it ends in the vaginal opening or introitus. And the pubococcygeus muscle is a really important pelvic floor muscle that sometimes gets stretched during childbirth. The vestibular bulbs, or the bulbs of the clitoris, are two organs about the size and shape of pea pods. They lie on either side of the vaginal wall near the entrance, and they're located under the labia minora. They're erectile tissue, and they lie very close to the crura of the clitoris. The Skene's glands are the female prostate or paraurethral glands. They lie between the wall of the urethra and the wall of the vagina. The Skene's glands ducts empties into the urethra, and they secrete a fluid that's biochemically similar to the male prostate fluid. Skene's glands are the female prostate. Next, we have the uterus, also called the womb. It's the size of a fist, and it's shaped like an upside-down pear. It has different parts. The cervix is the narrow lower third of the uterus. The fundus is that top of the uterus. And the body is the main part of the uterus. There's 3 layers of the uterus: the endometrium, the inner layer, the myometrium, the middle layer, and the parametrium or serosa, the outer layer. Has anybody ever heard of the disease endometriosis? Yeah, endometriosis is sometimes occur when people have tissue that is the same tissue as the endometrium, that has glands and blood vessels, that's located outside of its normal location in the uterus. And sometimes it will be outside in the abdomen, and it will react to hormones just like the endometrium does, and so it will produce blood and slough off tissue, and it can cause extreme pain for people who have endometriosis. The myometrium is one of the components of the uterus that really helps the uterus to stretch during an embryo and fetus's development, right? And as the fetus and baby develop, right, then the myometrium is able to stretch and then help to contract the uterus upon delivery. The fallopian tubes, also called the oviducts or uterine tubes, are extremely narrow, and they're lined with these hair-like projections that we call cilia. And the cilia help the egg to move down the fallopian tubes into the uterus. So fallopian tubes are the pathway by which the egg leaves the ovaries, and it's where the sperm generally reaches the egg. The fertilization of the egg typically occurs in the infundibulum section of the fallopian tube that's closest to the ovary. The fimbriae are those finger-like projections that are on the end of the fallopian tube that act to move the ova or fertilized egg into the fallopian tube. The ovaries are 2 organs about the size and shape of unshelled almonds, and they lie on either side of the uterus. And the ovaries have 2 different functions. For one, they produce our ova, our eggs. They also manufacture female sex hormones, estrogen as well as progesterone. They also contain numerous follicles, the capsule that surrounds an undeveloped egg. Which of the following is true of ovaries and egg cells? A woman with only one ovary cannot conceive. B, the ovaries produce eggs and manufacture sex hormones. C, the ovaries are connected directly to the fallopian tubes. D, the eggs cannot be fertilized outside the fallopian tubes. So which one is true? B is true. The ovaries produce eggs and they manufacture sex hormones. A woman with just one ovary can conceive. Absolutely, she can, which is a wonderful thing. And eggs can be fertilized outside of the fallopian tubes. And ovaries are not connected directly to the fallopian tubes. Remember, the fimbriae swish up the eggs from the ovaries. So although they're not directly considered sexual organs, the breasts are really important in sex and reproduction because breast consists of 15 or 20 clusters of mammary glands. Each of those mammary glands has a separate opening that goes to the nipple that are surrounded by fatty and fibrous tissue. The nipple is where those milk ducts open at the tip of the breasts, and the areola is that slightly darker area that surrounds the nipple. Breasts are very important in erotic excitation during sex, and so in that way they are related to reproduction. And they're very important in the psychological aspect of feeling attractive for many people who have them. All right, so next we're going to cover male sexual and reproductive organs. But before we do that, we're going to go back and talk about breasts. Because one of the things that I wanted to mention about breasts is that the size of breasts does not indicate the amount of sensitivity of the breasts. And so regardless of the size or shape of breasts, their sensitivity is the same. All right, so now on to male sexual and reproductive organs. So here we have a sliced in half picture of a male with a penis who has the penis in the front and the anus in the back. So it's easier to orient with, you'll notice, a picture of male sexual anatomy than it is with female sexual anatomy, right? You'll see the pubic bone in the front of both of these images. So on the left-hand side at the bottom, you'll see the scrotum, right? Inside the scrotum is the testes. And on top of the testis is the epididymis. The epididymis is coiled up seminiferous tubules. The epididymis comes to the vas deferens. The vas deferens goes up into the abdomen. You remember how I told you that the testes travels down to the scrotal area, but it comes through ways of the abdomen during development. And so you'll see the vas deferens moves into the abdomen, and then it's met by the seminal vesicle, and they join the urethra, and they become here out the penis. So you'll see the scrotum, the testis, and the epididymis, the vas deferens moving up into the abdomen, coming and meeting the seminal vesicle here, meeting here to become the ejaculatory duct, and then here joining with the urethra. We have the glands of the penis, then we have the corpus cavernosa. There's two of them, one on either side. Then we have the corpus spongiosum, which is in the middle, right here, on the back side. On the top of the penis, we have the two corpora cavernosa, or when it's one of them, we call it the corpus cavernosum. There's only one corpus spongiosum that's on the back that houses the urethra and that composes the glands. There's the prostate gland here, located underneath the bladder. Here's the rectum. Here's the Cowper's gland that produces the precum or pre-ejaculate. All right, so the male external organs consist of the penis and the scrotum or the scrotal sac. Here's this picture again. Let's do a quick review. Here at the bottom we have the scrotum, the testis, the epididymis, the vas deferens that moves up here around the pubic bone, travels here, joins the duct from the seminal vesicle to form the ejaculatory duct, meets up with the urethra from the bladder to come out here and come out of the urethra. We have the corpus cavernosum that joins with its other corpus cavernosum to become the corpus cavernosa on the top of the penis. Then on the bottom, the back of the penis, we have the one corpus cavernosum that makes the glands and that holds the urethra. We have the prostate gland that's located underneath the bladder. Here's the bladder. And you'll notice here we have the Cowper's gland that produces precum or pre-ejaculate. Right? And then you have the rectum here. So the external parts of the penis, we have the glands or the end or tip of the penis, the meatus or the urethral opening. It's the opening at the end of the glands where urine as well as semen pass through. You have the body part of the penis, the main part of the penis, the body or the shaft. Then you have the corona, which is the raised ridge that separates the glands of the penis from the body or shaft of the penis. Then we have the foreskin, or the prepuce, which is an additional layer of skin that forms a sheath-like covering over the glands, which is absent in circumcised penises. So you'll see here is a picture of a penis, and you'll see here is the urethra. This is the corpus spongiosum. There's only one of them. There's two corpora cavernosa, right? And here they are. This is erectile tissue. It kind of looks like spongy tissue because blood fills into it when the penis becomes erect, right? Here's the glans penis here, the head of the penis. And here's the corona, the crown of the penis. And there at the end is the urethral meatus or the urethral opening. So the internal parts of the penis, internally the penis contains three long spongy cylinders, the corpora cavernosa, the two bodies that lie on top of the penis, and then the corpus spongiosum is a single body that lies on the bottom of the penis that the urethra runs through the middle of. The two long cylinders of spongy tissue lying on the top of the penis are called the A. Bartholin glands, B. corpora cavernosa, C. corpus spongiosum, or D. vas deferentia. Which one? Yeah, it's corpora cavernosa, B. That's correct. So what's male genital cutting? We talked about female genital cutting. We often don't refer to circumcision as being male genital cutting, but it is one type of male genital cutting. In circumcision, there's a surgical cutting away or removal of the foreskin on the penis. Supercision occurs when they make a slit in the length of the foreskin on the top of the penis. This is common in areas like Mangea that we talked about, islands in the Pacific. Subincision is when they make a slit on the lower side of the penis along its entire length. This is common in some Aboriginal Australian cultures. The scrotum, also known as the scrotal sac, is a loose pouch of skin that's lightly covered with hair, and it contains the testes. The scrotum is very temperature sensitive, and during cold weather, the scrotal sac becomes thicker, becomes opaque, and it becomes kind of ridged as the skin comes up. And during the hot weather, the scrotal sac becomes elongated and the scrotal skin thins out to where it becomes almost tumescent or see-through. The testes, or the gonads, or reproductive glands in the male. They manufacture reproductive cells called sperm, and they also manufacture sex hormones, testosterone. Which of the following is true of the testes? A, the testes move away from the body in a cold environment. B, the testes are endocrine glands. C, the testes move closer to the body in a hot environment. Or D, the testes are analogous to the clitoris. Which of these is true? In fact, the testes are endocrine glands, and I told you that the testes move toward the body in a cold environment. Why would that be important? You want to protect the sperm, and you don't want them to get too cold. And so you move them closer to the body to keep them warm. Inside the testes, we have the seminiferous tubules, which are a long series of thread-like tubes that manufacture and store sperm. Sperm, seminiferous, both begin with S, right? So seminiferous tubules manufacture and store sperm. Interstitial cells are found in the connective tissue between the seminiferous tubules, and they produce testosterone. And you'll notice interstitial has 3 T's in it, so it produces testosterone, the interstitial cells. So here's a figure showing the internal structure of the testes. You can see in between the seminiferous tubules that are in blue are where the interstitial cells are located in between the seminiferous tubules. They're coiled upon each other, the interstitial tubules. They meet up at what's called the rete testes here. And then the sperm that have been manufactured and produced, right, then go in to be stored in the epididymis. And during ejaculation, they move from the epididymis to the vas deferens, right? And so you'll see that here. This is a great image of showing the internal structure of the testes. The epididymis is a long tube that's coiled into a small crescent-shaped region on the top and the side of the testis. It is a small little crescent region on the top and the side of the testis. The epididymis stores and it helps to mature the sperm. The vas deferens is the tube that goes up and out of the scrotum, and it passes through the prostate where it is called the ejaculatory duct. Now, what's important to know is that when we talk about getting a vasectomy, where does that word come from? Yeah, it's because we've nipped the vas deferens in a vasectomy. The seminal vesicles are 2 sac-like structures that lie above the prostate, behind the bladder, and in front of the rectum. They produce about 70% of the seminal fluid of the ejaculate. The seminal vesicles, seminal, produce 70% of the seminal fluid, seminal. So that's one way to remember their function well, is they both include the word seminal. Seminal vesicles produce about 70% of the seminal fluid of the ejaculate. The prostate gland lies below the bladder. It's about the size and shape of a chestnut, and it secretes a milky alkaline fluid that's part of the ejaculate. That alkaline fluid helps to protect the sperm as it travels into the urethra, because we know that urine from the bladder is acidic, and so the milky alkaline fluid from the prostate helps to protect the sperm. The Cowper's glands, or the bulbourethral glands, are located below the prostate. They empty into the urethra, and they produce pre-ejaculate a secretion just before ejaculation the precum, it can contain this milky fluid as well, and it can also contain sperm. And so I know I've told you before that people can become pregnant from precum, right? The secretions that come from the Cowper's glands. The prostate A is fairly large at birth, but shrinks markedly during puberty. B secretes a milky alkaline fluid that's part of the ejaculate. C cannot be felt in a rectal examination. D is comprised entirely of glandular tissue. The prostate B secretes a milky alkaline fluid that is part of the ejaculate. In the discussion board, I ask about a list of things you would change if you could about the male and female reproductive anatomy, and I ask you why. I'm also going to ask you in office hours. So we've now reviewed the female sexual anatomy and the male sexual anatomy. It's really important to note that about 2% of people are born intersex, right? Where they could have internal or external anatomy that may be different. Now we're going to talk about cancers of the sex organs. We'll talk about breast cancer, cancers of the cervix, endometrium, and ovaries. Then we'll talk about cancer of the prostate and cancer of the testes. Breast cancer is the second most common form of cancer in women, second only to skin cancer. The risk factors are genetic factors, although most people who have breast cancer don't have anyone in their family that had it. However, if someone had it in your family, you're at a much greater risk of having it. Risk factors also include long-term use of hormone replacement therapy after menopause and obesity. The ingestion of high amounts of fats put you at risk for breast cancer. So how do we diagnose breast cancer? Well, one way is doing a monthly breast self-exam and doing it at about the same time every month, because over the course of menstruation, you'll have changes in your breast. So you want to make sure that you do your breast exam, your self-exam, around the same time every month, and do a thorough breast exam. Make sure that you know how to do a breast exam and that you monthly do a breast exam. Did you know that everyone that has breasts can get breast cancer? Both people who are male, female, as well as people who are intersex can get breast cancer. So make sure to do your self-exams. Also, to diagnose breast cancer, you could have clinical exams done by a clinician, and mammograms for people over the age of 35 or 40. They will get mammograms. Some of the drugs used to treat breast cancer may prevent it in high-risk individuals. So some people who have a genetic BRCA1 or BRCA2 genes may take medications to help prevent them from getting breast cancer, should they be at very high risk. Breast cancer can be difficult for women, not just because of the treatment of having the breast cancer removed and then preventing it from recurring, but also because there's a lot of cultural pressures around breasts as being a sign of beauty in women. And so for women, when they have to have their breasts operated on, it can be difficult for them psychologically as well. So there's different types of breast cancer surgeries. There's lumpectomy, where only the lump and a small bit of the surrounding tissue is removed if there's just a very small amount of breast cancer suspected. If there's larger amount of breast tissue that is malignant, then they'll do what's called a modified radical mastectomy, where their breast and underarm lymph nodes are removed when they think that the the cancer may have moved into the lymph nodes. And then there's also a radical mastectomy, where they remove the breast, the underlying pectoral muscle, and the underarm lymph nodes. The psychological impact of breast cancer and mastectomy can be enormous, right? And it may cause women to feel symptoms of depression and anxiety. It's important to know if you should feel a lump in your breast, that about 80% of lumps are benign, meaning non-cancerous. Many of them are cysts, which are just fluid-filled sacs. Some of them are fibroadenomas, but most lumps that people feel in their breasts end up being benign, not malignant. However, it's important to get them checked out. The most common cancers in women after breast cancers are cancers of the cervix and endometrium and ovaries. 95% of cases of cervical cancer are caused by the human papillomavirus, HPV. The Pap test is a highly accurate, and it can detect cancer long before a person has any symptoms. In fact, the Pap test is one of the most successful public health campaigns that's ever been done. Having women get an annual Pap smear if they're sexually active is really effective in preventing the onset of cancers of the cervix. A vaccine has been approved for females and males ages 9 to 26 that prevent the most common strains of HPV. If someone has cancer of the endometrium, they'll oftentimes do a hysterectomy, a surgical removal of the uterus. And sometimes in cancers of the cervix that are not able to be treated through a cone biopsy or cryotherapy, they may also do a hysterectomy. If ovaries are removed, sometimes they will also do a hysterectomy for ovarian cancer as well. Ovarian cancer is oftentimes called a silent killer because oftentimes the symptoms are similar to the symptoms that women get with stomach upset, irritable bowel syndrome, and so they don't seek treatment as they don't attribute these symptoms to being due to any form of ovarian disease. The death rate from cervical cancer has decreased sharply since the mid-1960s, mainly as a result of A. Pap tests, B. CT scans, C. genetic mapping, or D. encephalograms. Yeah, it's the Pap test, named after the physician who first discovered it. So how do then we test to see if we might have ovarian problems? Or how do we test for a Pap smear? Well, in figure A, you'll see that a speculum has been put in place into the vagina. This is a person with a vagina who's laying down on their back with their leg up, and the speculum is inserted into the vagina with lubrication. Now, lots of times they use plastic speculums. It used to be metal speculums that they would increase on the side using a little wheel that would increase the diameter of the opening of the speculum. And when they closed it, sometimes they would pinch. And so it's very wonderful now that they use these plastic, much more comfortable speculums. So they insert the speculum and they open up the speculum so that an iris spatula can be inserted into the vaginal canal, and then they scrape the cervix, the opening of the cervix, with this spatula, and they get cells off of the cervical entrance, and then they use those cells, they look at those cells and they stain the cells to see if the cells have been are normal shape or if they're misshapen, and whether they contain human papillomavirus. So they can tell you about the health of your cervix. Sometimes people will get their pap smear results back and it will say that they have dysplasia. So sometimes then they'll want to test another pap smear in a number of months later to see if the cells have returned to normal or if they have become looking less healthy. And so sometimes they'll also do cryotherapy where they will freeze off the part of the cervix that looks like it may not be as safe. And so they will try to remove any cells that don't look healthy using cryotherapy. If there is even more unhealthy tissue, they'll sometimes do a cervical conal biopsy where they'll kind of cut out a cone of tissue around the cervix. On the right-hand side, you'll see a bimanual pelvic exam. And so while a woman is getting her gynecological exam, she'll oftentimes have a pap smear as well as get a bimanual pelvic exam where the doctor will put the finger of the one of the hands on very near the clitoris and insert two fingers into the vaginal canal to feel up towards the cervix, and then they'll put their top other hand on resting kind of on the pubic bone and push down towards the uterus on either side to feel how the uterus feels as well as feeling down towards the ovaries. And this is a way for them to kind of feel if the uterus as well as the ovaries feel healthy. Now it's really important to note here that when people with vaginas go to get a pelvic exam and go to get their pap smear and their annual gynecologic exam, that the gynecologist is generally not testing for sexually transmitted infections. And so if you are sexually active and you need to be tested, then you would want to get tested either at the health department or free testing sites or here on campus on Thursdays, or you would want to ask your physician. Before you ask your physician for STI testing, make sure to ask about the price because it can be very expensive at physicians' offices because they don't get the same sort of federal grants as public health departments and other non-for-profit agencies do in helping to prevent the spread of sexually transmitted infections. Cancer of the prostate is the second leading cause of cancer death in men after lung cancer. The early symptoms of prostate cancer are frequent urination, difficulty urinating, and difficulty emptying the bladder. Also, men who have early signs of prostate cancer can have frequent erections and an increase in their libido or their sex drive. The diagnosis of prostate cancer generally happens through a rectal exam. Men over 40 should have a yearly rectal exam. Also, prostate cancer can be diagnosed by a blood test called the prostate-specific antigen test, or PSA. Preliminary diagnosis of prostate cancer is by a what? A, rectal examination, B, pap test, C, CT scan, or D, angiogram. It's by a rectal exam. The preliminary diagnosis of prostate cancer is through the rectal exam. Cancer of the testes is a disease of young men. Really, the cause is unknown at this time. The first sign is a painless lump in the testes or a slight enlargement or change in consistency of the testes. Sometimes people with cancer of the testes may also have pain in their lower abdomen or groin. And the diagnosis of cancer of the testes either occurs through a physical exam or a testicular self-exam and ultrasound. It's really important to encourage people to examine their testes. We oftentimes hear about breast self-exam, but oftentimes we do not hear enough about testicular self-examination. So for people that have testes, please encourage them to do regular self-exams of their testes. You can feel a testicular nodule is a possible problem. It's important to do the testicular self-exams. You'll notice that on the top and on the outside of the testes, you'll feel the epididymis, that kind of crescent-shaped twirling up the seminiferous tubules there on the top and the outside of the testes. But in the inside of the testes, if you should feel a nodule, then you would definitely want to seek medical attention to have an ultrasound to test that out. So please encourage those that you know to do testicular self-examinations. Testicular cancer is much more common in younger males. So it's really important to encourage people with testes to do self-examinations. All right, so that's the end of Chapter 4 on sexual anatomy. I appreciate your being with me and listening to this lecture today. I made a few verbal mistakes and corrected them when I caught them. Please follow along with the PowerPoints when you are listening to the lectures, as it will really help you. Before you start a lecture, always make sure to read through the outline first. That'll help to give you a scaffold while you're listening through the lectures. And I hope that you have a wonderful day.